And the father of universal healthcare law, Senator J.V. Ejercito, is recognized to ask questions to the distinguished sponsor of the budget.
Thank you, Mr. President.
Mr. President, I am ready to listen to the expert.
Thank you, and I'm very happy also to see that my fellow health advocate is the one defending, of course, the budget of the Department of Health. And Mr. President, before I proceed with my questions, I'd like to express my gratitude, and I'm very happy to see familiar faces in the DOH who I've worked with the past couple of years when we passed one of the most important or most significant pieces of legislation in our history, that is the Universal Healthcare Law. And the only regret that I had in the 3 years of my absence is that during its first year of implementation, I was not here. But I'm very happy that with our sponsor, Senator Pia Cayetano, Senator Risa Ontiveros, my fellow health advocates were here, of course, to keep watch and make sure that the budget of the DOH is well taken care of, no, under their watch. And as far as I can remember, I'm sure that the sponsor can might recall, I was in a study trip in Japan sometime 2018. When you called, I was in Japan, and you were so excited, no, that the UHC was about to be passed. So that so we go a long way, and I'm very happy that I hope that this time around we still have a long way to go towards its full implementation. But together, I think we will be able to reach that goal, no, while working together. Mr. President, Madam Sponsor, when we are deliberating the UHC Act, we recognize the limited government resources, and as such, we settled the phasing implementation of the UHC, and the estimated timetable for the law then was 10 years. This was before COVID-19 happened. Considering the effect of COVID-19 to our meager government resources, may we know from the Secretary and from the DOH family if there is a change in the timetable of the implementation of the Universal Healthcare Law?
Meron ba? Wala po.
Yung,
Kasi-
kaya.
Because even during the pandemic, we were implementing UHC.
Mr. President, this is my own words, not the secretary's, pero during the pandemic, hasang-hasa sila. So instead of na-delay, tuloy-tuloy naman yung implementation. So the good news is, on target naman sila.
And likewise, during the pandemic, I think it really exposed all the more the weaknesses
Yes, which
of our healthcare system, and all the more that we really have to work for the full implementation of the UHC.
agree.
And I'm really glad that Secretary Berheria here, who was the face of the DOH during the pandemic, we are glad that to be working with you again to realize its full implementation. Madam Sponsor, Mr. President, can we spread it to the record, the annual budget allocated for UHC since its initial year of implementation up to our proposed budget next year? I ask this because I want to have a picture on what we could expect from the UHC law. Gusto rin po natin ipakita sana kung magkano ang funding gap para sa UHC implementation.
Okay. Your Honor, did you just ask for the current or did you want the past also?
Probably the past, no, from the
Past few years.
first year of implementation. Anyway, it's been
Okay,
2 or 3
2020
years.
ba
only.
Ano ba? 2020.
2020.
Is that
Yes.
okay? Yeah.
Yes.
For 2020, 171.9 billion. For 2021, 205.8 billion. For 2022, 263.3 billion. And for 2022, 315 billion is what we have in our Senate version, Your Honor.
Well, that's good to know because we want to know how much we can what we can do, no, to address that gap. Because as far as I can remember, the first year of implementation, it was supposed to be about 240
Okay.
billion.
Sorry, Mr. President, Madam President, I'm being corrected here. I said for 2022, 315, that's 2023. So the last figure I mentioned is 2023. That is the
2023.
Senate version. We
Yes.
don't know what the final one will be.
Yes, hopefully we can address the gap because during the first year of implementation, I remember, Madam Sponsor, Mr. President, It was supposed to be 247 billion, but what was funded was only 170.
Yes.
So hopefully we can address that gap as we go along and hopefully funds permitting.
Yes, Your Honor.
One of the components of required expenditure for UH implementation is the capital expenditure, funds for our health facilities. I remember our target then is to reach the ratio of 1 hospital bed for 800 population, 1 rural health unit for 20,000 population, and 1 barangay health station per barangay. May we know where are we on this? Magkano pa kaya ang kailangan natin to be able to reach this ratio?
Ratio.
Our ratio now for hospitals is 0.99. Ratio for hospital is 0.99. 0.99 for every share, for every where the population. Eh yung sa RH,
It's mixed. Dali na. Hindi naman. Dali lang. Ano na. Nagko-code. Hindi mo yung natin tapos to do. Dali. Pinera. Dali naman.
Madam President, when it comes to the hospital bed to patient ratio, we are still not at par with our ASEAN counterparts, no? They are at, ano nga ba yun? Can I say it?
Vietnam is 2.4.
Yeah, Vietnam is 2.4 for every 1,000, and we are still at 1 to 1,000.
So hopefully we can address this in the coming years, no? With us here to support the DOH. My next question is about regional and specialty centers. The President on his last SONA expressed his desire to expand regional and specialty centers and bring healthcare services closer to our people. Actually, here in the Senate, our Senate President, Mig Zubiri himself, and a lot of our senators also share the same advocacy. This will also make the implementation of the UAC more effective and more efficient. I, together with our Senate President, our other senators already filed bills on the establishment of these regional hospitals and specialty centers. During the committee hearing, it seems unanimous among stakeholders that specialty centers in DOH hospitals are more feasible rather than building new hospitals. Foremost, may we know the status of the specialty centers currently in operation in the provinces. From what I recall, Madam Chair, Madam President, we started this through the RHFEP a few years ago, like the Southern Philippines Medical Center in Davao, Northern Mindanao Medical Center in Cagayan de Oro, Vicente Soto Memorial Medical Center for Central Visayas, Western Visayas Medical Center for Panay and Iloilo, and Baguio Hospital were identified as specialty centers and are already performing. In fact, some of them are already performing open heart surgeries and other procedures. My question is, how much is the budget next year for the continued operation of these existing specialty hospitals so that we can augment if necessary para ho magtuloy-tuloy yung ating pong vision to have specialty centers in strategic areas? Madam President, Madam Chair.
So ito po, Senate version with ano na, ito lang po, sige, ito po kasi ito specifically for specialty centers.
2 billion naman.
Wait lang.
I agree with the statements and the statement of the gentleman from San Juan about the findings of experts being that the establishment of the regional hospitals in the specialty centers would be ideal. It would be easier. So in fact, as His Honor has just pointed out, of the 329, 46 already are operational, as the gentleman has pointed out, because it's very easy. Nandun na yung structure, nandun na rin yung mga doktor, nandun na rin yung facility. So we hope to continue with this. Now, with respect to the existing budget, the Senate has increased by almost 1 billion support for various specialty center hospitals. And then in addition to that, under the HRET budget, there is 1.8 B, Your Honor.
So that brings the total to about 2.8 billion for the specialty centers operation.
As an additional appeal to the House of Rep, which is 2.2 billion. It's not set now by. The three. But what do you have under?
Yung existing.
Pumasok na daw po to sa GAB. Yung 2.2 na appeal. Ay, hello sir.
Ako, additional to. Pero nabigay ito po. Just to add, Madam Sponsor, Madam President, the original request of DOH was about 2.34 billion for the current specialty centers. So I'm just asking if this is already enough, so that if we can supplement or augment, is 2.34 billion.
Reflected in the GAB. Sa GAB na daw po. Opo.
Ito.
Ito.
So yun ang Ito. Your Honor, I beg His Honor's indulgence just because I'm trying to reconcile the figures, because we support what you're trying to do. You're simply trying to establish what is the additional funding that is required, no? I want to give you the exact figure because we made the Senate Finance Committee approved provided for additional, but there's a different amount that the DOH is showing me.
Sa GAB 2.5.
Would His Honor like to go to another point? I don't want to leave it
Okay.
because I support the position I know you want
Yeah,
to
we'll
take.
just go back to it.
But so that in the interest of time, let's go back to it while
Okay.
LBRMO and DOH are
Yeah, but
reconciling their
also
figures.
this early, Madam Chair, I'd like to thank the Chairman of Finance Committee for adding 1 billion for
1B.
for 1B for specialty centers.
Almost 1B,
That is
exactly.
also the
Your Honor.
advocacy of our Senate President. So
Yes, thank
I'm,
you.
this early, we'd like to thank the Senate President
Na nire-reconcile natin
and
eh,
the
kasi
Finance Chair.
nalilito din ako dun sa, even LBRMO is checking with DOH, no, kung ano ba talaga yung
The
figures.
figures
We
that
do
is
not
needed.
want to under-declare all the support that the Senate through our chairman has already given. Of course.
Just very quickly, with the permission of our Senate President and the our distinguished colleague from San Juan. Yeah, I actually met with the secretary. We were in Malacanang. I wanted to meet with her separately on this issue in specialty centers because I wanted to kick it off in Cagayan de Oro, in our area of Senator Pimentel, and to start in Northern Mindanao. You know, we have to start somewhere. Apparently, they've been starting it already. They have in Davao,
Yes.
in Cebu. So there's key areas. So have you mentioned, sorry, I was listening to the news. Wasn't listening to the interpellation.
Meron.
Which centers are already up and running? Like Heart Center. Do you have, I know you have in Davao. And you have in
Well, actually,
Cebu. Is that correct? Vicente Soto?
yes, Your Honor.
Meron na.
Yes, yes.
So what are the other areas that,
For heart,
for Heart, for example?
for heart. What are the other areas for heart? Well, while they're looking for it, Your Honor, let me just point out, sa Region 10, Northern Mindanao Medical Center for Heart.
Yes, they're setting it up, I think,
Yes,
believe na.
yes.
Yes.
So saan pa daw meron sa heart?
So meron na, is it already operating, Madam
Marinos
Secretary?
Marcos, also for
It's in the
heart.
north,
In
yes.
Ilocos naman.
And
Batangas Medical, meron din heart.
Bicol Medical Center.
Bicol Medical, may heart din.
Regional.
Western Visayas, Bicol Regional, so 2 in the Bicol region. Eastern Visayas, may heart din po. Northern, we already mentioned Northern Mindanao.
yes.
Southern Philippine Medical Center in Davao. ang
It's
may
Davao,
heart.
that's the
Yes.
biggest one.
Or multiple, no? Not just heart, no?
It's
Because-
supposed to be sana heart, kidney,
Correct, correct.
and I think cancer. or
lung.
Lung.
Sa Southern Philippines is heart, renal, lung, and cancer. Sa Eastern Visayas Medical Center, it's heart, renal, lung, and cancer. And the beauty of all this, Your Honor, is because the model is to attach it already to regional hospitals.
Correct, yes.
They have some kind of practice going on. They have the support system, they have the infrastructure. Already, Your Honor, we have been able to put up 46 out of the targeted 329 specialty center
So-
just in the last few months.
So I would just want to ask, of course, I can't ask Secretary, I'll just ask it through you. But Madam Secretary, dear sponsor, are these already functioning? Like the one when you say there's a heart center in Northern Mindanao Medical Center, NMMC, when I have a patient that needs to do a bypass
So they're-
or a stent operation,
they are.
can they go there or will they still have to be referred to Davao or will they be referred to Manila, to the heart center?
Sa Cotabato Regional, sa Bicol Medical Center.
So can they go there and actually get treated there for a bypass?
Actually,
Meron na tayong doktor doon?
yung example nga na binigay nila, nag-open heart surgery na in Bicol Regional, Bicol Medical,
Cotabato
in
Regional.
Cotabato Regional. So, the
Buhay
same,
naman, buhay naman. Okay naman, buhay.
that's the
I was
important
just wondering.
question, Your Honor.
I just put it on record.
I think
Magaling naman.
it would be safe to say that they are at various degrees of operation.
Okay.
Perhaps you can put this in writing. It shouldn't be so hard. Para lang, it
Yeah.
feels good to know, no, na
Yes.
fully operational,
Yes.
whatever.
That's wonderful. Because the reason why we had not a problem, but we have a bill that we filed here to really establish it no matter what administration will come in and out of this country. I think the only pagkakatalo namin is the problem of setting it up on a standalone.
It
So-
will take a lot of time and
A lot of
and
time,
more
money,
funding.
and more funding. Then you have to start from scratch.
Actually, Your Honor, human resource, which as you know, being a
Yes.
author of our Doktor
Yes.
Para sa Bayan, ano?
Yes. So yes, so we agree. Maybe we'll amend the bill with the permission of the secretary. We may amend the bill to remove the clause already standalone. It could be already part of the regional centers. Then
Actually,
we'll ask the support from everyone.
it was already heard.
Ah,
It
Ay,
was
may
already
regional-
heard.
May draft committee report na pala
Yes,
tayo.
okay na. Iraround na yan
Wonderful.
for signature, Your Honor.
Wonderful.
So I
Thank
think
you.
yung concern nyo na ma-amend na lang to include this kind of setup is definitely there.
Yes,
Because my
fantastic.
bill actually was this kind of version. If I may, Your Honor, yung tinatanong nyo na kung operational na yan, I can share this chart with you wherein it shows per hospital if nandyan na yung expert personnel check, nandyan na yung infrastructure, the OR check, the lab check, cardiac surgery equipment check. So pag naka-green lahat, fully
I'll just ask for a copy, ma'am, from the secretary.
Ito yun.
So thank you. That's all. I'm just happy to hear about that. You know, this is the kind of news that we should come out with. That we have, people don't know, and it's not your fault. It's your doing your best to set up all these regional centers. But this is the kind of good news we need to bring out to the countryside, to the television stations, to mainstream media, that we already have regional centers. You know, sometimes online they say, oh, ano nangyari sa pangako mo na regional centers? Nandyan na pala. So,
Oo nga.
I think we have to start
Mr.
putting this out.
Pwede kayo mag-talk show with the secretary. Tapos araw-araw, imbis na
Bigyan na lang natin ng budget.
call it report the secretary.
Oh,
Yung
bigyan natin ng budget.
bagong na-open na, na
Imbis na lang-
specialty center.
Imbis na lang yung mga reports COVID. Si Secretary pa lang nagbibigay ng COVID, silang ilan namamatay, ilan natatamaan. Siguro ilang specialty hospital na, ilan na ginamot natin sa doktor natin,
Yung nabuhay doon.
nabuhay, at ilang pang natutulungan.
Yung down
Yeah.
ng dagdag na buhay.
Amen to that. Thank you very much. Thank you, JV, for giving me time. I just wanted to raise that small,
And
very
exactly
important
naman,
issue.
because we needed that time to answer his honor's question. Nakikinig ang ating chairman. Laki-lakihan natin yung figure na ire-report ko naman, ano. So, Mr. Chairman, ang nasa GAB kasi is 2.2 billion. Kineri natin yan, 2.2. And then dinagdagan ng 0.9 of a billion. Kaya nga almost
1 billion.
1 billion. So the total is 3.1. But ang gusto sana nila secretary to really fast track this is nasa 5 point.
It's additional 2.2.
Oo, 2.2. So
Additional 5.
lalabas na ni
2.2.
Chairman ang kanyang checkbook for 2.2. yun naman, of course the 900 will go a long way, but 2.2 yung ano talaga nila dream
Dream.
number. Yes.
The reason why I asked, because for the information of also of the Senate President, while I had the chance to go around, no, and I'm very happy to know that I talked to Dr. Chan, the Medical Director of Northern Mindanao Medical Center. Indeed, they were able already to perform open heart surgery. And in SPMC, Southern Philippines Medical Center, we just inaugurated the last before PRRD step down, yung cancer center, the lung center, and heart center is already functioning. So that's the reason why I asked, so that we can already supplement and complement the other areas that need. I know that the most expensive here is medical equipment, no? Kaya nga po yung capital outlay yung hinihingi nila. So again, for the record, so it's about 2.9 billion total. What is
Ano yung 2.9?
2.9 ba? 3,
Ang request nila is
2.2.
2.2.
We added
We
0.9.
already have 3.1.
3.1 billion.
And they would like to have 2.2
To
more.
fast track the
Yes.
the
The access,
other specialty
the
centers.
access
Yes.
specialty services to the Filipinos kasi all over the country talaga tayo maglalagay nito.
Well, that's good to hear. But I'm glad that the Senate President, I know that this became his
We
advocacy
hope
as well,
the majority floor leader will
And,
stop talking to the chairman
so that he would
that
hear.
the chairman will hear the number again and again.
I think they are all listening. All the Senate leadership are all here, and I think they have their ears. We have their ears right now. So that's the reason. So Mr. Finance Chair, yun lang po ang dream na 2.2 billion daw.
Pero in fairness lang,
No,
having
that's what,
defended the
yung
budget,
naman yan, yun yung dream.
I'm not sure. Now that there are more gentlemen here, I have to say this. No less than the Deputy Minority Floor Leader recognized that through the leadership of our chairman and now our
Yes.
Senate President, the Senate has consistently been increasing the budget of healthcare. The minority recognizes that, dear colleagues.
So this early would like to thank the Finance Chair for adding almost $1 billion. No, for
Yes, it's already done.
thank you for that. So
Madam President, with the permission of the two legislators who have the floor, may I just know what is the 2.2 billion for on the record?
Equipment. Capital outlay.
that's capital outlay, probably equipment.
Specific hospital so that we can
Okay,
equip them.
Okay, sige. So earlier, Your Honor, I in response to the Senate President's question, we gave a short list, no, of some of the specialty hospitals that are now performing, basically now have these specialty services available. And so the Secretary gave me a list of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Tama ba?
So bigger po.
Bigger paper. Okay. Well, I can just give the copy. But basically, there are 10 hospitals now that need 2.2 billion in total. And their sites are ready and they need it for lung and renal equipment. Some need an actual construction of a building. So I guess this is all capital outlay, no? This is all capital outlay. Yeah.
Madam Chair, with the indulgence of my dear colleague, what about yung sa regulations, Madam President, distinguished colleague, yung need, because I was told about the lack of staff, puro na nga po job order ito, walang plantilla, etc. Hindi ba kasama yun dun sa pinag-uusapan natin right now? Because I think all of us wanted to have a fast licensing program, no? Pero kung wala namang staff, wala na nga, hindi na nga ho plantilla, walang plantilla, wala pa ring job order.
To prepare for this, Your Honor, the existing specialty hospitals go to these hospitals to train their existing personnel, but within the regional offices, they have operational budget to hire extra. And these are among those who will also be trained. Do I answer your question? From the look of your face, I did not.
But it will still fall under the job order category and there's still training pa, Madam Chair.
Actually naman po,
Kasi sa train pa eh.
permanent positions na mga, yun po yung tinitrain natin.
No, let me answer this way, no. This is my own words, but I will look to the secretary to see if this is accurate. Given that these are very specialized procedures, for more reason, they would need, I believe, regular hires here because they will invest training in them and this is specialized training. So, it's more reason na kailangan mga regular nakaplantilla yan. Di
Yes,
ba?
exactly.
Oo naman
But
daw.
up to this time, there's no plantilla position. Is that correct?
Saan yan?
Additional.
With the permission of Senator Joel, our majority floor leader, correct me if I'm wrong, Madam Secretary, Madam Sponsor. A heart surgeon is a highly trained individual as a doctor.
Of course.
It costs tens of millions of pesos to train such a highly skilled
Yes.
a doctor. Their salary the salary of government is not enough for them to stay in government service. So nangyayari dyan, like with us in Bukidnon before, when we had to look for a specialized, yung sa, the one who handles the CAT scans, he's the radiologist and all, we could only give him a particular amount of the province, but he really has to moonlight elsewhere.
Correct.
Kasi he has to work private sector. Unless we pay him the sun, moon, and stars, even I don't think our salaries are enough for a heart surgeon. Heart surgeons are the best of the best, diba? Together with brain surgery and all. So yun ang problema. If you make them plantilla, they cannot, if they're government employee, I don't think they're allowed to work outside of government, right? Maybe that's the problem.
Oo.
Oo nga.
Yung actually to distinguish your honors, when I responded or if you overheard the response of the secretary on plantilla, I personally was referring to the staff. Oh, kasi as of to answer the majority floor leader's question, to question na ano sila ano tawag dito, JO. Now, your question, Mr. Senate President, is different. Yung mga ganyan na highly specialized doctors, consultant yan. You're right.
Yes,
They end up, I think it's a regular practice that they are practicing in 2 or 3 hospitals, whether here in Metro Manila or in the province. It's not the intention na maplantilla sila because it would limit, no, for most.
Kasi
no,
they're-
for most.
They will be, by law, they will not be able to do so. They cannot work outside for
Yes.
double compensation.
Oh.
So consultants, yeah.
But-
So we have to be lenient to that, with that,
But
because
actually-
it's difficult.
Your Honors, when I was a new senator and chaired the Committee on Health, that was already something I was asking the secretaries there, the ilang secretary na pagdaanan ko na, pwede bang baguhin yun for the health sector? Because why would you limit this person who is already dedicating X amount of his time for barely, not making much? So baka that's something.
Actually, Madam Sponsor, we had exempted certain offices, government offices already. I think
Exactly.
ombudsman,
Exactly.
I think OGCC, so that they can hire good lawyers because the lawyers were not accepting plantilla
Correct.
positions because of the low rates. So maybe for the Department of Health, for certain
Again.
services, di ba, we can do that.
I would be happy to,
I just don't want to know if it'll cause a ripple amongst everyone else, the doctors. Yan ang mahirap, baka magtampo yung ibang doktor.
may ganon. Dati wala ganon. Dati consultant ka lang. Ngayon part-time
So
employee ka na. So now they already have, the civil service has already is already allowing part-time employees. So instead of consultant, which is what we are familiar with, pwede na yung part-time employment. Anyway, maybe we can discuss this further. Our objective is to give our highly trained specialists, even the staff, maraming highly trained staff, don't get me wrong, not just doctors, the opportunity to advance their careers both in public and private in the Philippines sana. Yes, yun yung gusto natin. That's what we want for them. Thank you, Mr. Senate President.
Thank you, Madam Chair. Thank you, distinguished colleague. Yeah, just
Which brings me to my next question. No? I think it is also related about human resource for health. Kasama na rin po siguro, we will also include the needed specialists. No? Siguro baka pwede na rin natin isama kung pwede na yung mga part-time and consultants so that we can hire and be able to tap our good doctors and specialists. We cannot implement, o hindi natin pwedeng implement ang universal healthcare kung wala pong ating mamasipag at magigiting na health professionals. So, sa UHC Law, meron tayong isinama na National Human Resource for Health Master Plan. And according to DOH Accomplishment Report, meron naman tayong nagawang master plan. Ang tanong ko lang po ay ilan po ang health professionals na kailangan natin sa bansa, magkano naging budget natin sa health sector para sa mga ito, at sa ating mga health professionals. Siguro isama na rin po natin yung mga, the ones that would be needed for the specialty centers that we target. Yung just the rough estimate probably.
Ratio po ng number, and ito po actually deploy for
No, but the universe. Meron ba tayo nun, the universe? Ilan ang...
Mr. President, Madam President, next to ask questions.
Oh, sorry. One pa lang.
Mr. President, in response to the question, for physicians, we have a total of 40,000. That's what you want, no? The numbers, di ba? 40,850 physicians spread across the region, no? 107 for nurses, 175,900. For midwives, 57,108. For dentists, 4,761. For medical technologists, 18,748. Nutritionist, dietitian, 1,957. For pharmacists, 4,847. For physical therapists, 980. Napaka-konti, Ang daming may kailangan nito. 980. But you know, sorry to digress, but they're so highly in demand abroad and paid really well. Occupational therapists, this is so sad. 93. 93. I know. Radiologic technologists, 3,953, and X-ray technologists, 691,000. Wala dito si pharmacist. Parang wala, no? Ayun, meron. Okay, sorry, na-miss ko lang. So that's what we have. That's our universe of health professionals, Your Honor.
With that response,
You already know, no?
we all already know, no? The shortfall talagang kulang.
Yeah.
That's why we really wanted to know what's the strategy, and so that we can, probably in the coming years, probably next year's budget, we can again augment and supplement yung needed healthcare workers, no, physicians, yung mga kulang natin, physical therapists and others, so that we can have, we can assure the supply of healthcare workers, no, from
And I want-
doctors into healthcare
I
workers.
would like to spread into the record and let His Honor know that we have, again, with the support of our chairman, Senator Angara, and the majority floor leader, not just Doktor para sa Bayan, but we have been working with SHED to pinpoint which SUCs are already teaching these allied health professions, and we have been able to put some budget for that, Your Honor, in the current budget.
Well, that's all. I'd like to thank our sponsor, Senator Pia Cayetano, and of course, our fellow health advocates, and of course, thank the Senate leadership led by our Senate President, Finance Chair, and everybody for the support to the health sector. So hope now that we have heard already the needs, so we'll see, we will do our best, no, so that our dream of having a better healthcare system, no, of course, that's part of the UHC, and probably, Madam President, that we can say that the government is effective only if our healthcare system is likewise efficient and effective. So with that, Majority Leader, Madam President, I wrap up my interpellation.
Suspended.